Hi everybody, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson, and this week on Friday we're going to celebrate National Nurses Day, and so we have Chrissy here who's a labor and delivery nurse in the Green Bay area, and she's here to just chat with a little bit. A lot of questions we get is, how do doulas and nurses work together, and is it a really good thing? So I'd like your insight, what has been your experience?
Sure, absolutely. I've seen it come a long way. We've started seeing a lot more doulas with our labor patients, and I think it is a great thing. I think working together and having the patient being the focus. So we both have this patient in mind, and while we know the medical things, so I can listen to baby's heartbeat, I can check her cervix if we need to, do those medical type things that sets her blood pressure. You guys help do the holistic thing as well. I mean, we do that too, but I think you guys are so much more finely tuned into that. So we have that broad focus where we can do medical, holistic, and kind of blend it all together to make an experience that's really great for the mom.
Sure.
I mean, labor is a tough thing. They're working hard, and they need support from as many people as we can give them. So if we can get it from me, if we can get it from you, if we can get it from Nikita, from Sam, all the other doulas, game on. To me, I like that.
And do you see a benefit of doulas with the continuation of care? I know a lot of feedback I've gotten is that your shift ends, and you also have numerous other patients to deal with.
Right.
You know, do you see a benefit in knowing that you have peace of mind that there is a doula in the room with that client, with your patient?
Absolutely.
We call them clients, you call them patients.
Yeah.
You know, that there's that continuation of I'm not going to have to worry. I still will wonder what's happening.
Definitely,
but,
because as a nurse, you do feel like you are pulled in a bunch of different directions, especially if you have a laboring mom and you might have another laboring mom or a patient who's postpartum. And the reality of healthcare is that I can't be at the bedside every single minute on my shift. Would I want to? Absolutely. But absolutely, knowing that I have another backup, someone else that's able to support my patient when I'm not there to eyeball. So if she needs something, you can help her, or if it's something that you can't do and you need my help, then you guys can get a hold of me. Yeah, definitely. And it's always a bummer when, you have a labor patient and your shift ends, you know?
Yeah.
And so then we leave, and then we have another nurse that comes on, and to have you guys, I know you do a two doula, a backup system, so you guys can kind of interchange where there's still that continuity of care.
Sure.
Yeah, absolutely.
Awesome. Well, thank you, Christy. Really appreciate it, and happy National Nurses Day on Friday.
Thank you.
Thanks, guys. This has been Tuesday Talks with the Green Bay Doulas, and we will see you next week. Happy Mother's Day as well, guys.